I know in elementary school, there were times where PE class would be happening and I would have to sit in the bleachers and not participate.
26-year-old Kaitlyn Dubaz has been a heart patient since the day she was born, with her pulmonary artery and aorta connected to the wrong parts of her heart and a hole between the bottom two chambers of her heart.
But after I was born, they noticed something was wrong and I got airlifted by helicopter to Children's Mercy. I got 2 open heart surgeries done.
One of those surgeries was a Fontan surgery to improve blood flow by disconnecting her inferior vena cava from her heart and reconnecting it to her pulmonary artery, using a tube to make a new pathway. But over the years, that new pathway has narrowed.
I fatigue quicker. I can't maybe lift as heavy as some people. I can't keep up with other people my age.
Her cardiology team is putting in a stent to widen the Fontan pathway created when she was just a little girl.
It expands the diameter of the Fontan to allow more blood flow.
At the helm, University of Kansas Health System cardiologist and Adult Congenital Heart Disease Program Director, Dr. J.D. Surface, and Children's Mercy Hospital cardiologist, Dr. Toby Rockefeller, who also specializes in congenital heart defects. These two often team up when treating patients who've transitioned to adult care from their pediatric care team.
Just oxygen.
Because the anatomy of someone born with a congenital heart defect can be so different compared to the heart patients without anomalies,
this is what they're talking about. So your
before the procedure, Dr. Surface uses a dry erase board and markers to explain to the rest of the team exactly what's about to happen. It's just one example of the many qualities Kaitlyn says she appreciates most about him.
I like talking to Dr. Surface. He's really straightforward and he's very nice. He likes to educate.
They reach Kaitlyn's heart by going through a vein in her leg, operating most of their tools while watching the screen above the procedure table for guidance. And take a look at that mesh tube at the center. What you see there is one stent already deployed, and that tube is a second stent not yet deployed. Kaitlyn's procedure requires 2 to cover the length of the passageway, or Fontan conduit. Once both are in place, the doctors will dilate them with balloons until they open up the passageway to the target size. And Kaitlyn will be home by tomorrow with greatly improved energy levels, just in time because she has a big trip planned with her husband coming up.
Kind of as like a 1-year anniversary/honeymoon type deal. I do want to tell other people with my condition that you're stronger than you think. I just want other people with my condition to feel just as strong as I do sometimes.